Landmark Trials in Gastric Cancer Surgery. Today we review the TOPGEAR trial. For years, surgeons have debated whether adding preoperative chemoradiotherapy to perioperative chemotherapy improves outcomes in patients with resectable gastric and gastroesophageal junction adenocarcinoma. The TOPGEAR trial was designed to answer this important question. Following the CROSS trial, preoperative chemoradiotherapy became an accepted approach for esophageal and gastroesophageal junction cancers. Whether that benefit extends to gastric cancer remained controversial. TOPGEAR was an international Phase 3 randomized trial enrolling 574 patients with resectable gastric or gastroesophageal junction adenocarcinoma. Patients were randomized to perioperative chemotherapy alone or perioperative chemotherapy with preoperative chemoradiotherapy. The primary endpoint was overall survival. Adding preoperative chemoradiotherapy significantly increased the pathologic complete response rate from 8% to 17% and improved tumor downstaging. However, these pathological improvements did not translate into better progression-free or overall survival. Several important questions remain. First, the study was conducted largely before FLOT became the standard perioperative regimen. Second, gastric and gastroesophageal junction cancers were analyzed together. Given the historical role of chemoradiotherapy for gastroesophageal junction tumors after the CROSS trial, whether selected junctional cancers derive greater benefit from radiation remains an open question. Finally, TOPGEAR reminds us that better pathological response does not necessarily translate into improved overall survival. TOPGEAR did not change my practice. It confirmed it. Based on these results, I do not routinely add preoperative radiation to perioperative chemotherapy for resectable gastric cancer. High-quality surgery combined with effective systemic therapy remains the cornerstone of treatment. If you found this review valuable, please subscribe for future videos on robotic gastrectomy, gastric cancer surgery, landmark studies, surgical techniques, and evidence-based practice.